You can die in your sleep. 7 quiet nocturnal habits that can lead to death after age 70. Imagine lying down to sleep like any other night and never waking up again. Sounds scary, doesn't it? The truth is that, after the age of 70, some nocturnal habits can become dangerous and increase the risk of serious problems, such as heart attack, stroke, and even sudden death during sleep. What's worse is that most people have no idea that small attitudes before bed can be sabotaging their health. Are you making any of these mistakes without realizing it? In this video, you'll discover 7 quiet nighttime habits that can put your life at risk. The latter habit is the most dangerous of all, and many people do it without even thinking twice. Don't take that risk. Let's get started. First habit, the fatal mistake of eating late at night that overwhelms your heart. Do you have a habit of eating late at night? Hunger before bed may seem harmless, but after the age of 70, this habit can be extremely dangerous. The human body works differently in old age. Metabolism slows down, digestion slows down, and the cardiovascular system becomes more sensitive to any overload. When you eat before bed, especially heavy meals, your body is forced to continue working in the middle of the night instead of resting and recovering. Now, imagine the impact of this on the heart. Studies indicate that eating late can cause blood pressure spikes, changes in heart rate, and even trigger arrhythmias. In addition, fatty foods or foods rich in refined carbohydrates increase blood sugar levels, favoring the accumulation of fat in the arteries. This overload can lead to heart attacks or silent strokes during sleep. The hidden danger that few perceive. Many seniors ignore subtle signals that the body gives after a late meal. Symptoms such as heartburn, burning in the chest, and reflux are common, but few people know that these problems can lead to more serious complications. Gastroesophageal reflux, for example, is a common condition in those who eat before bed. When you lie down right after a meal, stomach acid can back up into the esophagus, causing irritation and inflammation. Over time, this can lead to breathing problems and even aspiration pneumonia, which can be fatal for the elderly. In addition, reflux can trigger episodes of sleep apnea, a condition where breathing stops repeatedly during the night, reducing oxygen in the blood. This puts further strain on the heart and can lead to serious cardiovascular events. What can be done to avoid this risk? The good news is that changing this habit can be simple and bring immediate benefits to your health. Here are some essential recommendations. Eat dinner at least 3 hours before bed. This time allows your body to process food without impairing rest. Avoid fatty foods that are high in refined carbohydrates. Swap pasta, fried foods, and sweets for light proteins, vegetables, and whole grains. Elevate the head of the bed a little. This can help reduce reflux and improve digestion. If you need a snack before bed, choose something light. Fruit, plain yogurt, or a handful of nuts are all good options. By making these simple adjustments, you avoid unnecessary overloads on the heart, improve sleep quality, and significantly reduce the risk of nighttime complications. But that's just the first fatal mistake. The next habit is even more insidious, as it involves something that everyone does on a daily basis without imagining the risks. Second habit, the hidden danger behind drinking too much water before bed. Drinking water is essential for health, especially as we age. However, there is a time of day when drinking too much fluid can be more harmful than beneficial: before bed. If you have a habit of drinking large amounts of water or teas just before bedtime, you may not realize the risk that this can pose. The problem goes far beyond constant trips to the bathroom at night. This simple act can increase the risk of falls, fluctuations in blood pressure, and even heart problems. Why is drinking too much fluid at night dangerous? With advancing age, the functioning of the kidneys changes. They continue to filter blood throughout the night, but the bladder's ability to store urine decreases. This means that if you drink a lot of water before bed, the chances of needing to get up to urinate several times increase considerably. And here's the real danger. When you get up in the middle of the night to go to the bathroom, you could take a serious fall. Studies show that nocturnal falls are one of the main causes of hospitalizations in the elderly. In the dark, with the body still sleepy and blood pressure falling due to the change in position, the risk of dizziness, fainting, and fractures is very high. In addition, excess fluids can overload the heart. During sleep, the body slows down the heart rate and adjusts blood circulation to favor rest. When you drink too much water at night, there may be an increase in blood pressure and heart rate to compensate for the extra fluid volume, which can be dangerous for those with heart problems. Another worrying factor is that constant sleep disruption can accelerate cognitive decline. Sleep deprivation affects memory, increases inflammation in the brain, and is associated with a higher risk of dementia and Alzheimer's. What can be done to avoid this risk? Fortunately, this problem can be avoided with a few simple changes in routine. Drink plenty of water during the day, but reduce your intake in the last few hours before bed. The ideal is to stop drinking large amounts of fluids at least 2 hours before bedtime. Avoid diuretic drinks in the evening. Coffee, black tea, green tea, and even some juices can increase urine production and make the problem worse. If you feel thirsty before bed, take just a few small sips of water. Avoid large glasses or whole bottles. Turn on a soft light and move calmly when you get up at night. This helps prevent sudden falls and dizziness. If you follow these recommendations, you can sleep better, reduce your risk of nighttime falls, and protect your cardiovascular health. But beware. The next dangerous habit may be preventing your body from recovering properly during sleep. You may be making this mistake without even realizing it. Third habit. Why can sleeping in a hot room be a mortal danger? A cold night often causes people to reach for heaters, weighted blankets, and tightly enclosed rooms to ensure comfortable sleep. However, excess heat during sleep can be extremely dangerous for those over 70 years old. Many seniors don't realize that keeping the bedroom too hot can increase the risk of cardiovascular problems, dehydration, and even sudden death during sleep. The human body needs to regulate its internal temperature to ensure a deep and restorative rest. When the temperature of the environment is too high, this regulation is compromised, causing negative impacts on the body. What happens when you sleep in a very hot environment? Our body naturally lowers the internal temperature at night to facilitate deep sleep. This is because body cooling favors metabolic processes that are essential for tissue recovery and memory consolidation. When the environment is very hot, the body needs to work harder to try to dissipate this heat, which overloads the heart and impairs rest. In addition, excessive heat can lead to nighttime dehydration, an especially dangerous problem for the elderly. When the body loses fluids during the night through sweating, the blood becomes thicker, which increases the risk of thrombosis, stroke, and heart attacks. Another worrying factor is that a room that is too hot can interrupt deep sleep cycles, causing the person to wake up several times during the night without realizing it. Quality sleep deprivation is directly associated with an increase in blood pressure, worsening brain function, and weakened immune system. What if you already have heart or respiratory disease? For those with heart problems, such as hypertension or heart failure, sleeping in a hot environment can be even more dangerous. This is because the body needs to work harder to cool the internal temperature, which requires greater effort from the heart. This extra effort can trigger episodes of arrhythmia, increased blood pressure, and even heart attacks. For those suffering from respiratory illnesses such as COPD or asthma, a stuffy, hot room can worsen symptoms by making it difficult to breathe and reducing blood oxygen levels. How to keep the bedroom at the ideal temperature for safe sleep? Fortunately, small changes in the bedroom environment can help reduce this risk and ensure safer sleep. Keep the room temperature between 18 degrees Celsius and 22 degrees Celsius. This is the ideal interval for restful and safe sleep. Avoid blankets that are too heavy or thick sleepwear. Prefer lightweight and breathable fabrics, such as cotton. Use a fan or humidifier to improve air circulation. This can help prevent heat buildup in the room. If possible, leave a window ajar to favor natural ventilation. This helps to keep the air fresh and reduce the risk of overheating. These simple changes can protect your heart, improve your breathing, and ensure deeper, safer sleep. Now that you know that a hot room can be a hidden danger, get ready for the next dangerous habit. It involves something that many people do without realizing it and can significantly increase the risk of stroke. Fourth habit: the position you sleep in may be increasing your risk of stroke. Most people sleep in the same position for years, never imagining that it might be harming their health. But after the age of 70, the way you lie down can make all the difference in your quality of life and especially in your safety. Studies indicate that certain sleeping positions can increase the risk of stroke, hinder blood circulation, and even impair breathing during sleep. If you've never worried about it, it's time to pay attention before this habit becomes a real danger. What is the worst sleeping position after 70? Sleeping on your back can be extremely risky for seniors, especially those who suffer from high blood pressure, sleep apnea, or heart problems. When you sleep in this position, the tongue and throat tissues can partially block the airway, reducing the amount of oxygen that reaches the brain. This can lead to episodes of obstructive sleep apnea, a dangerous condition that causes breathing to stop and return several times during the night. Over time, this lack of oxygenation can contribute to brain damage, increased blood pressure, and a higher risk of stroke and heart attacks. In addition, sleeping on your back can also hinder blood circulation, especially for those who already have vascular problems. Blood flow can be compromised, favoring the formation of clots, which are the main cause of ischemic stroke. Is sleeping on the right side a good option? Many people think that sleeping on their side is always safe, but few know that sleeping on their right side can put a strain on the heart. This position can put pressure on the inferior vena cava, a large blood vessel that carries blood back to the heart. This can hinder circulation, increasing fluid retention and the risk of heart failure. What is the best sleeping position after 70? The position most recommended by experts is to sleep on the left side. This posture helps improve blood circulation, facilitates digestion, and reduces the risk of gastric reflux. In addition, this position favors the flow of blood to the brain, reducing the chances of a stroke during sleep. How to transition to a more secure position? If you have the habit of sleeping on your back or on your right side, it can be difficult to change positions from one moment to the next. However, some strategies can help you. Use a firm pillow between your knees to keep your spine aligned. This improves comfort and prevents back pain. Support a pillow behind your back to avoid rolling into the wrong position during the night. This helps keep the body on the left side. Try an orthopedic neck pillow. It can improve breathing and prevent neck pain when changing positions. If you suffer from reflux, slightly elevate the head of your bed. This reduces the burning sensation and improves breathing. Making this change can significantly reduce the risk of stroke, improve circulation, and provide safer, deeper sleep. Now that you know the importance of the sleeping position, get ready to discover a habit that can cause dizziness, serious falls, and even fainting in the middle of the night. Fifth habit: the mistake that can make you faint or fall when you get out of bed. Have you ever felt dizzy or a slight darkening of vision when you get out of bed? This is a warning sign that should never be ignored, especially after the age of 70. Getting up abruptly in the middle of the night can cause a sudden drop in blood pressure, leading to dizziness, imbalance, and even fainting. This problem, known as postural hypertension, is one of the main causes of falls and fractures in the elderly. Now, imagine waking up at dawn to go to the bathroom, getting up too quickly, and in seconds, feeling the floor disappearing under your feet. This happens because, when moving from lying down to standing, the blood takes a few seconds to circulate correctly, which can lead to fainting and dangerous falls. The danger hidden behind a nighttime fall. Falls are extremely dangerous for the elderly. Many of them result in hip fractures, wrists, and even head trauma. In many cases, a simple fall can lead to serious complications, such as loss of mobility, prolonged hospitalizations, and, unfortunately, even death. In addition, a fall can cause a ripple effect on health. The fear of falling again causes the person to move less, leading to loss of muscle mass, worsening of balance, and greater risk of new falls in the future. Another worrying factor is that some falls can be caused by sudden fainting. If a person has low blood pressure or is dehydrated, the brain may not receive enough oxygen when standing up, leading to momentary loss of consciousness. What to do to avoid dangerous falls when getting out of bed? Fortunately, a few simple changes can help you avoid this risk. Get up slowly. When you wake up, first sit on the edge of the bed and wait a few seconds before getting up completely. This helps the body regulate blood pressure. Keep a glass of water near the bed. Dehydration can aggravate postural hypertension, so drink small sips of water before getting out of bed. Use night lights. A dark environment increases the chances of trips and falls. Install soft lights on the way to the bathroom. Hold on to something firm when you get up. A support at the head of the bed or a handrail nearby can give you more stability when getting up. Avoid slippery clothing and carpets. Bare feet or slippery socks can increase the risk of falls. Wear non-slip slippers. By following these tips, you significantly reduce your risk of nighttime falls and protect your long-term health. Now that you know how to get up safely, get ready to discover a dangerous habit that many people overlook, and that could be a sign that something serious is happening to your body. Sixth habit: snoring, breathing stops, insomnia. Ignoring this can be fatal. Many people believe that snoring at night is normal, especially with advancing age. However, frequent snoring and momentary stops in breathing during sleep can be signs of a serious condition called obstructive sleep apnea. If left untreated, apnea can dramatically increase the risk of heart attacks, strokes, and even sudden death. What happens to your body when you have sleep apnea? During sleep, the muscles in your throat relax. For some people, this relaxation causes the airway to become partially or fully blocked, preventing airflow. This causes the person to stop breathing for a few seconds, several times during the night, without realizing it. Each time breathing stops, the level of oxygen in the blood drops dramatically, forcing the heart to work harder to compensate for this lack. Over time, this can lead to an increase in blood pressure, overloading of the heart, and a higher risk of heart attack and stroke. In addition, apnea sufferers are unable to reach the deeper, more restorative stages of sleep. This causes extreme tiredness during the day, impairing memory, increasing the risk of falls, and contributing to the development of dementia and Alzheimer's. How do you know if you have sleep apnea? Many people who have apnea don't even realize it. In most cases, it is the bed partner or a family member who notices that the person snores loudly, takes long pauses in breathing, and sometimes wakes up short of breath. Other common symptoms include feeling of suffocation at night, dry mouth on waking, morning headache, extreme tiredness throughout the day, excessive sleepiness, even after a full night's sleep. If you have these signs, it is essential to see a doctor and perform a sleep exam. Insomnia can also be a warning that something is wrong. In addition to apnea, another problem that many people overlook is chronic insomnia. If you have constant difficulty sleeping or wake up several times during the night for no apparent reason, this could be a sign that something is not working well in your body. Insomnia can be linked to cardiovascular problems, neurological disorders, and even hormonal imbalances. In addition, getting too little sleep can weaken the immune system and increase stress levels, worsening conditions such as hypertension and diabetes. What to do to improve your sleep quality and avoid risks? If you suspect that you have apnea or suffer from constant insomnia, some attitudes can help. Avoid sleeping on your back. This position facilitates the blockage of the airways and worsens apnea, Prefer to sleep on your side. Maintain a healthy weight. Excess fat around the neck can aggravate sleep apnea. Avoid alcohol and sedatives before bed. These substances excessively relax the throat muscles, making the problem worse. Create an environment conducive to sleep. A dark, quiet room with the right temperature improves the quality of rest. If necessary, use a CPAP machine. This equipment keeps the airways open during the night, ensuring a safer and deeper sleep. Identifying and treating sleep disorders can prolong your life, reduce your risk of heart disease, and improve your quality of life. Now that you know the seriousness of nighttime breathing problems, let's talk about a common mistake that many people make before bed, and that may be slowly poisoning your body. Seventh habit. The medication you take before bed may be slowly killing you. Taking a medicine before bed is a common habit for many people, especially after the age of 70. Whether it's a sleeping pill, a blood pressure medication, or a muscle relaxant, the routine of taking medicine at night can seem harmless. But do you know the risks that some of these medications can bring while you sleep? What few people realize is that some medications can affect breathing, blood circulation, and even brain function during sleep. This can increase the risk of falls, strokes, and even respiratory arrest. The danger of sedatives and sleeping pills. So-called benzodiazepines such as diazepam, clonazepam, and alprazolam are widely used to treat anxiety and insomnia. However, these drugs can decrease the activity of the central nervous system, making breathing slower and shallower. For seniors, this can be a danger, especially if there are heart or respiratory problems, such as sleep apnea. In addition, these medications can cause dizziness and mental confusion upon waking up, significantly increasing the risk of falls and fractures. Other common medications, such as some antidepressants and muscle relaxants, can also interfere with deep sleep, impairing the quality of rest and affecting memory and cognition. Remedying high blood pressure can be dangerous overnight. Many people take medications to control blood pressure before bed. This can be beneficial in some cases, but for some older adults, it can come with an unexpected risk: an abrupt drop in blood pressure during sleep. If the pressure drops too low, blood flow to the brain can be reduced, increasing the risk of an ischemic stroke during the night. In addition, very low pressure can cause the person to feel dizzy or even faint when getting out of bed at dawn. Indiscriminate use of painkillers can strain your organs. Many seniors take pain relievers such as ibuprofen or diclofenac to relieve muscle and joint pain before bed. The problem is that the frequent use of these drugs can overload the kidneys and liver, making it difficult to eliminate toxins from the body. In addition, some anti-inflammatory painkillers can affect blood clotting, increasing the risk of internal bleeding and even hemorrhagic stroke. What can be done to avoid these risks? If you take medicine before bed, it is essential to follow some precautions to ensure that they do not harm your health. Talk to your doctor. Never change your medication without professional advice, but ask if there are safer alternatives for you. Avoid unnecessary sedative medications. If you need something to sleep in, prefer natural methods such as relaxing teas and breathing techniques. Monitor your blood pressure. If you take high blood pressure medication at night, take regular measurements to make sure your blood pressure isn't dropping too low during sleep. Beware of drug interactions. Some drugs can enhance the effect of others, increasing the risk of dangerous side effects. Small changes in your medication routine can make a big difference to your safety and longevity. Now that you know the 7 silent nighttime habits that can put your life at risk, it's time to understand how you can act from today to protect your health and ensure safe and restful sleep. It's time to make changes and protect your life. Now that you know the 7 quiet nighttime habits that can put your life at risk, it's time to take action. Small changes to your routine can make a big difference to your health and longevity. What can you do today to improve your sleep and protect your heart, mind, and body? Maybe it's adjusting the temperature of your room, changing the position you sleep in, or avoiding that heavy snack before bedtime. Remember, every choice you make directly affects your well-being. Never underestimate the impact of healthy and safe sleep. Take care of yourself, seek medical advice whenever necessary, and adopt habits that promote a long and quality life. Your health is worth the effort.